Weight loss is an ongoing hot topic, and while some think of surgical procedures as a last resort, we sit down with Dr. Amy Clark from Fresno Heart and Surgical Hospital, who says that's a common misconception. Thank you so much for being here.
Thank you so much for having me.
So tell us a little bit about bariatric surgery, what it's about.
So our patients come to us usually in need of help to help treat their medical conditions, help get rid of their weight, help them essentially live longer and happier and healthier lives. And so we calculate the BMI, the body mass index, based off of the weight and the height. And we look at that and the medical comorbidities like high blood pressure, diabetes, arthritis, and we look at all those factors to determine if someone is a candidate for surgery and then which surgery would be best for them.
Okay, and so when someone comes in, what typically are common questions that you might get that, people may have a misconception about or whatnot?
So it's not just weight loss surgery.
Sure.
Ultimately, it's metabolic surgery. So it's not just to lose weight, it's to overall have a healthier life. And so usually what our patients will ask is what surgery will be like and what the recovery will be like. And the main thing that I tell them is that it's a lifelong process. So we help them prepare for surgery and we help get people through recovery. And then actually it's like we're friends for life. So we'll see, I'll see my patients every year for the rest of their life and to maintain and see how they're doing. So it's a relationship that we have for many years. And so you're not alone when you go through the process. That we're here with you.
Mm-hmm. You still have to go to the gym and you still have to eat correctly, correct?
Right. So you still need to do all the other things. It would be nice if surgery alone was the magic fix, but that's unfortunately not the case. And so we still have to do the diet and exercise. We still have to eat healthy, and so we have really good dietitians to help with that. And that's part of the reason why I like to see my patients long term to help maintain that, because the diet and exercise component is still crucial. So I think one of the common misconceptions about what we do is that people come to us because they have failed, because they've done something wrong or it's something that's their fault. But the really important thing to know is that obesity has so many different factors. It's not just that people eat too much. It's not just that you don't have self-control. I mean, those are horrible misconceptions that we're really working hard to fight. So there's so many other factors. There's our culture, there's genetics, there's things that we just can't overcome. And so if you're considering surgery, it doesn't mean that you've failed. It means that maybe diet and exercise alone has not worked for you, which all the studies have shown time and time again that does not work. Long term, it doesn't help for long-term results. So people can often lose weight in the short term, but years out, the weight will often come back. And so it doesn't mean you've done something wrong. It means that we need to do something to reset your set point. And that's what surgery can help do. So if you're curious about if surgery is right for you or want to hear more details about it, then we have a website, fresnobariatrics.org. Has a lot of really good information. There's an online seminar that you can watch. And you can help calculate your BMI and look at your medical conditions.
Amazing. Thank you for that information.